Good morning, everybody. How are we doing this morning? Thank you all for being here early on a Tuesday morning. We appreciate it. My name is Dave Heaney. I serve as the Chief Information Security Officer here at Mass General Brigham. I'm joined by some amazing panelists who are really going to bring a diverse set of viewpoints to some of these questions that we're going to talk about. And my hope is that we ask some questions that get them arguing a little bit, right? And bring some of those diverse viewpoints forward. And when I think about the potential and pitfalls of anything, and especially for AI in healthcare, I think about both upside and downside risk, right? So the downside risk is certainly evident in the potential cybersecurity and privacy implications, but the upside risk is there as well. And what I mean by that is either the risk of not using these and what that could mean for our patients, or just the risks that we take to potentially gain some upside in any conversation. So I want to start by going down the row here with our panelists and ask two quick questions. One, could you please introduce yourself? And then two, I want you to choose from one of the two of what is the greatest potential outcome that we could miss if we over-index on protecting against the pitfalls, or what is one pitfall that you are most concerned about in the adoption of AI in the healthcare space?
Thank you, Dave. Good morning, everyone. I'm Nancy Cam-Winget. I am a Cisco fellow, obviously working for Cisco Systems. Have been working in cybersecurity for longer than I will mention, focusing in areas anywhere from applying the cryptography now to dealing with how we secure AI. So to your question, Dave, I think I will go towards some of the pitfalls that I get concerned about of late is the notion of we have a wealth of information, we have lots of data by which we can train the AI models today. I think one of the issues that I will highlight, because there are many, is that of bias in the data that could lead to potentially misleading outcomes. I will say if we don't do that refinement. The second piece is the privatization of the data. So especially in the medical industry, we can use the data in an anonymized way to help with diagnosis, but making sure that we do it again in a privacy-preserving way so as not to leak personal information.
My name is Tal Liani. I'm from Bank of America. I cover cybersecurity, and I also cover Cisco. And sitting next to Nancy and talking about cybersecurity, I feel like the rabbit that went up to heaven and wanted to tell them about the big flood from the Bible, and he sees Noah in the audience. So I'll talk a little bit about cyber next to the expert. What I'm mostly concerned about is data loss. We know how to protect wires. We know how to protect buildings. We can put a bouncer in the building. We can put a bouncer that walks with you inside. And I'm talking in general terms, right? It's called zero trust. We used to trust our security. We don't trust the security anymore. So now we walk with you inside the building to make sure you're doing what you're supposed to do. We know that. The problem is that everything is migrating to the cloud. And if traffic before was going what we call north-south, meaning from the user to the data center, from the data center to the user, we had to protect just this. Today, traffic is going east-west within the data center. We send traffic to the cloud, and it starts moving around, because in AI, it goes around. And now, also, we used to have it confined. We used to have our applications confined in our own data center, and we were able to wrap it and secure it. Now we send it to Microsoft or Amazon or Google for processing, and it starts moving around. So how do we know that the data is not leaking out? And in my view, if you look at how the market is evolving in cybersecurity, data protection is one of the key risks to the network and the most challenging factor or the most challenging element in how to secure AI.
Good morning. Ariel Stern. I am the Alexander von Humboldt Professor for Digital Health, Economics, and Policy at the Hasso Plattner Institute, which is an engineering school in Germany. I'm also adjunct full professor of medicine at Mount Sinai, and the 10 years before last year I spent as faculty at Harvard Business School, hanging out with folks from MGB quite a bit. So my sort of these deeply important issues notwithstanding, I want to push back a bit. Of course, I also care about data loss. I also care about bias. I hope we talk about those a bit. But I think we have to think very deeply about the balance we want to strike, especially taking the patient's perspective. And we will get to a point very soon. Indeed, in some medical specialties, we are at that point already, where not using AI is basically malpractice. And so we need to think about, what is the right balance? And I think that's what we're all here to discuss. But how do we get there? There are a bunch of settings already today where if I were a patient, I would be furious if I didn't have access to AI-based diagnostics. And so we need to figure out, with taking these issues head on, how do we get to that point where we can actually deliver the best care?
Hi everyone, I'm Engy Ziedan. I'm a co-founder and chief scientific officer of Protege. Protege is a company that provides data, so I have revealed my bias to AI companies for training, fine-tuning, and benchmarking. Also a faculty economist. I'm a health economist at Tulane University, so somehow coincidentally, two economists ended up sitting next to each other.
Dangerous.
Dangerous. I think my perspective is there has to be a balance, but a realistic balance. So Protege was founded by people who came from the data privacy space. Without data privacy, there will be trepidation to share any data, and so innovation will be inhibited generally. However, I think we are at a moment in time where technological innovation in AI is at an inflection point analogous to antibiotics in the 1920s or early vaccines in the 1940s. And so if we take this on, this frontier, we have a lot of leverage to reduce healthcare costs and increase patient outcomes. I got a text message from a friend of mine who's 77 in the UK yesterday, and she said, the NHS is so bad now, the doctor at the cost cutters is gone, ChatGPT is my doctor now. And receiving that message, I kind of sat there and thought, well, we better make it good if people are gonna use it.
Hi everyone, my name is Rich Adduci. I'm an operating advisor for Berkshire Partners. I've been working in cybersecurity for well over 25 years now as a global CIO for Boston Scientific and National Grid, and before that Accenture as a partner. I think in terms of AI, so first of all, from my time at BSC, I come to appreciate quite a bit how impactful AI, and I'm going to speak about that in a second, can be for analyzing and helping us take on some of the worst diseases in the history of mankind, which largely haven't really been effectively treated. Things like congestive heart failure, as an example. But I think one of the dangers we have is we all throw AI around like Kleenex in terms of that term and what it means, to the point where it's kind of watered down to not mean much of anything. I think there's lots of great uses for AI, but also AI has become this magic elixir that can solve all problems and solve all maladies. And I think anybody who's worked in technology for more than 5 minutes knows those magic elixirs are sold by snake oil salesmen. They never really come to fruition. So you have to be very careful about where it applies. Whenever we're solving a business problem and there is no business case, no real justification, that's just research that doesn't really make sense in a broader business sense. So I think being thoughtful about how AI is being applied, what it really is, and how data is being used is very important.
Great, and I love the focus on the balance of the risks, and it's all about trade-offs. So I want to hone in on that just for a moment. So Nancy, your work has been instrumental in designing a lot of the cores of how organizations secure themselves today. Engy, you are looking to build a company and grow and expand as quickly as you can. In Ariel, so much of your work is focused in on the regulatory frameworks and how we keep oversight of it. So my question for the three of you is, can we have speed and safety? And how should the people here in the audience be thinking about the balance of those two things as they look to grow and as they look to leverage AI in their organizations?
I guess I can start. I think speed is happening, whether we like it or not, right? So thanks to the announcement of ChatGPT, the whole world now, you know, as Richard was saying, AI has become this overarching elixir. So there's a lot of innovation that's happening today, whether we want it or not, disruptions. I do think the medical field and the healthcare space is rich in that level of innovation. So speed will happen. I think we need to ensure that the guardrails are appropriately placed. As Tal said, right, everything has gone, I say everything has gone cloudy. But to me, it's more of that communication stack has really gotten more distributed. So from a safety perspective, the thing that I will continue to expand on is not just on the Zero Trust Foundation of reversing the trust and verify to really ensure that you verify and trust, or I should say verify before you trust. And so that includes really understanding the supply chain. And the supply chain is, as we now talk about the use, and sometimes I say the overuse of AI, where you have, whether it's the assistants or the different forums that can help you formulate that answer, or the multimodal notions of using AI, means there's a lot of little AI agents floating around that you really need to be aware of. So if, as a cybersecurity expert, if the SolarWinds attack taught us anything, is we really need to understand our supply chain of the AI infrastructure.
Sure, I can dive in. So the regulatory piece is really important. I want to so 100% what Nancy said, but we should also, safety is not just something that sort of is given to us and we have to accept it. Right. There are a bunch of things that our standard-setting bodies and also our regulatory agencies can do to create this ecosystem in which there is the type of baseline that you need to just stimulate innovation in the first place, which is what Engy was talking about earlier. I've done a bunch of projects where we look at actual FDA data sets to try to explore what's going on here. I can say something specific about the set of medical devices, including software products that meet the statutory definition of a medical device. We did a study, it's about 7 years ago now, where we just looked at the cybersecurity content of regulated medical devices, and we scraped about 40,000 product summaries from the FDA's website to actually do text analysis. It would have been 100 times easier today now that we have LLMs, but we did this the old-fashioned way. And what we found at the time that was alarming, and I'll tell you, but I'll caveat that, was that only about 12% of all of the regulated medical technology that included software had any mention whatsoever of cybersecurity or any related terminology in their product summaries. So whether you're looking for anything about NIST, anything about, like, we had a list of 25 keywords that we had figured out, and it's really, the biggest number you can get to was 12% of regulated medical devices saying anything, and this is in their publicly facing product summary. So this is the information that clinicians, that hospitals, and that patients have to go on when they're making choices about medical devices. That includes medical software, so anything used diagnostically or for treatment purposes in the hospital that meets the definition of a medical device, we're including that as well. I updated these numbers last week in anticipation of the panel. The good news is that we've more than doubled the share of software devices that talk about cybersecurity, they're publicly facing documents. The bad news is there's still a ton of headroom for this to improve. And even when you look at the set of devices where this is most critical, so we look at SAMD, which is software as a medical device, that's standalone medical software for diagnosis or treatment. You get that number up to like 37%. If you look at the FDA publishes a list that's updated quarterly of all of the AI and machine learning enabled medical devices. Within that list, it's about 36% of all devices. So that's better, but the flip side of that coin is that nearly 2/3 of all of the regulated AI and machine learning products that are on the market today don't include any information about their cybersecurity content in the publicly facing documentation available. That's not to say, and this is why I said, the last point, I want to be very careful. That doesn't mean that these companies are not taking thoughtful cybersecurity measures. But boy, would it help the folks making adoption decisions, and boy, would it help people who think about cybersecurity to know, and it might just be a one-liner. Nancy and I were talking about this earlier. It might just be a one sentence that says, by the way, we are compliant with the 2025 FDA guidance document on cybersecurity for pre-market submissions. If you just include that sentence, that would go a long way to building that trust and to helping us get more clarity there. The last thing I'll say is that the regulatory side matters a lot. We're talking about a lot of regulated medical products, and we know from studying high-risk medical devices that the more regulatory certainty there is about what is actually expected of products, the more innovation we get. There's a real penalty when there's the absence of regulatory clarity, and so we, as policymakers, can do more to foster that ecosystem that facilitates the good type of innovation, and I hope to see more of that going forward.
Yeah, I think, okay, so touch on the last point. I think that the lack of regulation actually impedes innovation. So at Protege, we are lucky to be able to observe two sides of the exchange. So we have our data partners who are healthcare systems, aggregators, and companies that share de-identified data. And then we have builders who are building in medical devices, whether it's solving the mammogram problem or the lung RAD problem, or foundation models that are taking enormous data sets for pre-training. And what we discovered is that as soon as there is trepidation around data safety, the data pipes dry up, and that impedes innovation generally. What we're facing right now, and actually the AI builders want to get more of that, they would like a regulatory framework that is accessible, clear, and transparent. Like, give me a test that I could take and pass and study for. Tell me what safety means when I build Gen AI. And there are levels to benchmarking and evaluations. People have written thoughtful things about it. The first level is like, does the AI do a good job at medical questions, MCQ? That's probably been solved. The second level is, if we got a bunch of doctors to rate its output, would it rate it well? That's kind of where we are right now, but where we would like to be is see kind of consistent evaluations of AI agents as they are installed in healthcare systems. How are doctors reacting to these agents? What is the net outcome on patient care? Caveating all this with the fact that AI has been there since the 1960s, and many of the innovators in the room who are building in medical devices have used vision models to save many people's lives for a very, very long time. So it's just an extension of that work, but at an accelerated rate.
It's not my turn, but I'm going to jump in. We spoke about speed, and you spoke about regulatory environment, and I want to make a statement. Always, the hackers, the bad people, will be ahead of us. That's the name of the game. Regulations will have to do with the fact of two things. Number one, the innovation happening by the bad actors is done quicker than, and we always need to respond. We're in defense mode. We're not in offense mode, number one. Number two, we spoke about AI, we spoke a lot of innovation, but the network is full with very old systems that need to be secured. So you talked about the percentage of devices, medical devices, that don't have cybersecurity in them. In the case of Target, the bad actors penetrated the network through the thermostats. Thermostats don't have an operating system. It's not a Windows machine. You cannot put a cybersecurity client on it to protect it. So how do you protect a device that is not the latest and greatest, and even in some cases doesn't have a way to put software on it, right? So, and the third thing of the complexity, and I'm just trying to open kind of the discussion to complexity, the third thing on complexity is when we talk about AI, you have two processes. You need to teach the system, that's called the learning process. So you take data of 100,000 patients, you put it in and you let it run, and it learns something. And then you have to use the data. You have to use what you learned. It's called the inferencing. But because of privacy rules, I'm not going to send any client information to Amazon or to Google to process it for me, to learn from it. So now I have 3-step process, and that's about speed that we spoke about. I have to teach, I have to learn what to do on data without client names and just generalities. Then I have to send the traffic from there to the customer, let's say a big hospital, and they have to do fine-tuning and add data with customer names or with ethnicity or with whatever you can, and do fine-tuning of learning. And only then they need to build a network to use the data, to do inferencing. So we spoke about speed, and the speed of deployment of cybersecurity to that is also, it also depends on the speed in which customers, enterprises, hospitals can deploy AI. How fast can they build systems on cloud networks? That's quick. But then how fast can they build their own networks? Because some of the processing cannot be done in the cloud. No one will let it happen. So, and that goes to regulations, back to regulations, because the cycle of deploying AI is not a one-step. It's not a product that you buy and boop, you have AI. You have to build processes in public cloud, in private cloud, in edge cloud. You have to put regulations on it. How do you use the data? How do you prevent data leak? These are all the things that will dictate how fast we can deploy AI in healthcare systems.
I just want to come back to what Engy said, and Tal was chiming in on it, because I fully agree. Actually, I'm the last person to advocate for regulation, because it can really slow things down sometimes. But I think in the space of innovation, you're absolutely right. I do think, though, I wish technology would be more leaders in this space. At the end of the day, regulators always trail technology. It's very hard for them to set policy on very leading edge technology. And really, all history shows that. If the technology firms are serious about innovation and serious about protecting our data, it's time really for them to stand up and begin forming some guidelines and standards that they can live within. And there's lots of good examples of this historically. That's really what's needed in the short term until regulatory bodies can catch up, which may take a decade.
So I want to bring the conversation back to data a little bit. So Engy, I think you and your company would suggest that healthcare data can certainly be an asset. Rich, as a CISO sitting in a similar chair to mine, you might suggest that it can be an asset, but it can certainly also be a liability if the data is lost. And Ariel, you might consider this data to be just a fundamental, foundational patient right. So again, for the business leaders out here in the audience, how should they all be considering their data in the year 2025 and going forward? What is data today?
So when we talk to generative AI researchers, they say healthcare data is just a conversation that's mimicking the body. Like, it's just telling us about health. The fact that a radiologist reads a mass and its size on a DICOM and an oncologist calls the staging is fine, but to teach a model, essentially we think of all healthcare data as trying to proxy for what is happening within someone's body. And so there are latent things that may be in your healthcare system that you've never thought to leverage to improve patient health that are very, very useful. There are obvious things that you're using currently, EHR data or imaging data, that you would think, if I had a model that could hold all of this attention in 1 minute, right, and remind my physician or steer him towards something aggregated that would be a risk, would be useful. But I guess my take on it is that it's the tip of the iceberg in terms of what data we are using to actually proxy for health. We're using medical records, but if we dig a little deeper, it goes all the way into different modalities, from imaging to genetics to pathology to conversations. And so the future innovation in that space to create truly generative models is very, very promising.
I would say that if you look at protecting data and you look at it over a 30-year time horizon, not a whole lot has changed except for some regulation. Regulators have high expectations of folks like Tal and me, what we can do to protect data. But in reality, the technology has never really caught up. DLP today looks just like DLP in the 1990s. There's an AI asterisk somewhere in the sales pitch of what you're going to get, but the reality is it's the same thing. It's pretty weak, not very strong. So what can you do? Well, that's a tough one. First of all, AI has become a stampede in many companies. There's a lot of pressure to adopt and deploy AI without consideration of where that data is going to. So as a technologist and as a company, you need to be thoughtful about where is AI application okay, what types of AI is okay, and what types are not. You need policy to support that because regulation isn't caught up in this space. Second, for data that's highly sensitive, unfortunately, you're going to have to find a way to tag that because AI and really any other technology is going to prove pretty light in its ability to distinguish between a sensitive piece of data that you're going to have to disclose to a regulator if it's compromised, and every other bit of data that you have, which is a sea of it. So you're going to have to invest in some form of tagging or other senses like that for sensitive data, and then you have to have technology that can restrict that stuff.
Ariel, any thoughts there?
Yeah, I mean, maybe briefly, just bringing in the European perspective, I think there's, so the General Data Protection Regulation really limits what can be done with data about health in the European Union. But, and I think that I'm cautiously optimistic, the European health data space, which has already come into force and will be fully rolled out by 2029, is actually going to create a set of requirements for healthcare institutions to make their data AI ready in a federated way. And so the sort of opportunity that doesn't exist yet but will exist in Europe in approximately 4 years is that we'll actually be able to train algorithms on data from Spanish, German, and French hospitals, and then do the fine tuning that needs to be done so that, but I just want to, I spend a bunch of my time in Europe these days. There is a lot of nervousness and frankly just skepticism about using even very sexy, exciting AI models that are trained on data from Boston teaching hospitals in rural France. Like everyone sort of gets that that's, for a whole bunch of reasons, probably not going to be a fit for purpose solution. There's increasing appetite in Europe for homegrown algorithms. And I say algorithms out of deference for the point that Rich made earlier, which is we call everything AI, but you know, a lot of times it's just kind of dumb algorithms. But I think just having a sensitivity to the complexities of using data in Europe, but also the fact that there's a very real opportunity and also possibility that European AI models will emerge from a totally different set of training data under completely different circumstances and potentially taking advantage of federated data models in a way that we don't have to in the United States. So I think this is just something I wanted to encourage everyone to keep an eye on.
Like a perfect storm, almost,
What's that?
for innovation.
Yeah. If I can just expand on some of this and back to your previous question on the regulations, I think we will need to have stronger regulations on the data, not just from the different privacy perspectives, Ariel, as you're mentioning too, right? But from a cybersecurity perspective, it is utmost important as we, you know, Engy, you talked about sharing the data to be able to improve on the inferencing, right? The training as well as the inferencing that goes in there. But imagine from a cybersecurity perspective, we need to put strong regulations into how that data gets used and how it gets stored so that it doesn't get poisoned in order to allow or enable the attackers to then skew that model to then give you bad results. So I think that's part of the regulation and the safety aspects that, you know, Dave, as you're asking what will happen, I think that's one of the considerations that we've been having discussions with, you know, the folks, the policymakers as well as the NIST, who's trying to come out with recommendations.
Yeah. Absolutely. All right, so as we're coming into the home stretch here, let's talk about the money. A little bit, right? So Tal, we've seen on the investment side a huge spending boom around AI and around infrastructure and cybersecurity spend around that. Rich, in your roles over the years, you've had to make investment decisions for your own organizations, right, and balance the purchase with the risk reduction. And Nancy, certainly you're on the leading edge of designing what we're all buying to be able to secure our organizations. So I'm going to cheat a little bit. I'm going to try to cram 3 questions in here. One, is all of this spending really resulting in an actual measurable risk reduction? 2, where should our organizations be focusing their infrastructure investments as they grow in their cybersecurity investments? And 3, how should people in the audience be thinking about changing their cybersecurity workflows in this age of AI? And maybe just pick one of the 3 there, but I wanted to get all the questions out there.
Should I start?
Sure.
You cannot afford not investing more on cybersecurity. It's not a question of whether it's wise to do it. It's critical to do it, because if you don't spend more, the intruders will just run faster and you'll compromise your network. The issue is that you're not spending on the same thing. We used to protect the network by putting a product ahead of the building, before the building, and just say go, no go, kind of. Not enough, because the intruders pretended to be someone else, legit user, and got in. Then we had to protect the network from within. Then we had to actually say, you know what, we don't trust you. We're going to go with the traffic that goes in to make sure that the traffic only does what it's supposed to do. Then we started to protect identity. Then so all I'm trying to say is that you're not spending on the same thing. Every year when you grow your budget, you're investing because the intrusion framework is changing. You have to adapt as well. So you don't have the luxury of not growing your spending. I have one of the safest positions at Bank of America because I know that my companies will ever grow their spending to protect their networks. So that's one thing. Second thing is the AI is an automation tool. AI, I know that if you're a programmer today, you always have the fear of being replaced by a machine, because someone, an AI module, ChatGPT, can probably program faster than a human being. In cybersecurity, AI is being used not to replace people. AI is being used to automate. And that means, for example, we got hacked. So now we need to do remediation. We need to bring down certain things. We need to contain certain things. Cybersecurity or AI can do it a lot faster. And there are modules today to automate processes. We're not at the point where, and you always need to have someone to help you, like a human being, to actually understand if this is a real intrusion or that's just Adobe trying to update their software, which is totally legit. So today, at least today, AI is being used to make much faster decisions at a much lower cost. No, you know what? I'm taking it back. It's actually very expensive. It's not lower cost. It's very expensive to do it. However, the response time that you get is quick. It doesn't take you 3 days to figure out. When Sony got hacked, if you remember Sony, when they did a movie against North Korea, and they got hacked by North Korean hackers, the whole network was down for 10 days. No one was able to play PlayStation, right, for 10 days, because they couldn't figure out where is the problem. You need to have a solution today. If I'm being attacked, I need to have a solution in seconds.
Those were a sad 10 days, I want to say.
Yeah. Right. So that's how AI is being used.
So on cyber, look, I mean, the flat, simple answer is yes. Most firms are safer today than they were 8-10 years ago. But also, what's the basis of that? Well, that's to say we had almost no protection 8 to 10 years ago. That was like AV and that was it, which we all know now is not adequate enough to do it. So then the question is, how much is enough? I don't think the answer is there never is enough, right? That doesn't make business sense. There is a trade-off to be had. I also don't think the concept of security should be invisible has any sense in the world. Security is not invisible. Good security is visible, and the same as should be true with cyber. Cyber does take everyone's effort in order to be successful, and there will be some things you have to do with cybersecurity to be safe. Things like zero trust have the potential, zero trust networks. Here again, another term that has been bandied about quite widely, when done correctly, has tremendous potential for helping you both in your own network and in the cloud secure your data, secure your applications in a meaningful way. There'll be constant innovation. We're never going to be able to outspend attackers. The money is overwhelmingly in their favor. And certainly we can't outspend nation states. But what we can do is be thoughtful about how we're implementing cybersecurity technology, making the right trade-offs, and making sure we are improving cybersecurity consistently with things like zero trust.
Yeah, I mean, Rich, to me, I call it the arms race. And you're absolutely right. I mean, the threat actors, the hacktivists, have far more funding than we in the industry have to actually provide the right tools to give you the protective measures. So that's number one. Two, to your point, right? To me, there's no such thing as perfect security. What may be risky to me may be a very different profile than what may be risky to you. Ariel was mentioning too, across Europe, Germany is very strict. The first thing that comes out of their mind is, okay, you're giving me this innovation, is it secure? Whereas the UK may be thinking more of, yes, security is important, but they're more heightened aware, or sorry, Switzerland is more heightened to the privacy considerations. So from that perspective, it really is, from an industry perspective, as a vendor, we have to be providing the right tools to keep up with that arms race, if you will, that the threat actors will always be there, right? As Tal was mentioning earlier, you mentioned, right, an attack disseminated from a thermostat. So an interesting statistics from a general Internet of Things. So this was something that I was starting to design cybersecurity for. So a decade ago, we had, what, maybe 10 million devices going through the internet. I don't know the statistics. I know it's well over 20 million today, but the latest statistics I saw was about 127 IoT devices are connecting, 127 IoT devices per second are connecting to the internet. So as you look at it from a healthcare perspective, right, whether you're doing diagnosis or whether you're in a social forum you're all flowing through the internet. And so this is where securing that network fabric, and as Tal was mentioning, the AI isn't just in your standard networking, but we're now distributing it everywhere. So by everywhere, when we talk about these foundational models that you may know them as ChatGPT or LLM, they require a very fat infrastructure. So that's why I was looking at Tal. It's a very costly, complex infrastructure. And so it's not just about protecting your edge of the network or your data center. You have to be cognizant of protecting the entire infrastructure.
Absolutely.
And I can't just say network,
right,
because the cloud compute and store needs to be protected as well. So this is to say, again, just coming back to the really understanding that supply chain, right? Because with the multimodal, you might be having an assistant that you're speaking. Well, that's one foundational model giving you the audio. You may have a camera, that's another foundational model. These are different supply chains, right? All of those need to be secure.
All right. We're about to get the hook here, but I want to go rapid fire. We're going to start with Rich and come back this way. In one sentence, what is, no semicolons, no run-ons, one sentence.
Darn.
What is one actionable, pragmatic step that people in the audience can take in the next 12 to 24 months to help create a truly robust, resilient, AI-enabled healthcare ecosystem?
I would say really look at your suppliers. Look at who's getting onto your network, look at who's using your data, ask a lot of questions, and make sure you're very clear with them on where the boundaries are. Are you allowing them to use AI to serve you or not?
All right,
That
I
should be a
counted 5
choice.
sentences there already, so I'm going to cut you off and we're going to move
Is there
on.
more
to
than a
Engy.
sentence in that? I'm an engineer. I don't do grammar.
All right, Engy, what do we have?
I think see AI as an opportunity, think about risk and bias, but also think about patient healthcare and technology. This is a moment in time that could really be an inflection in how we do healthcare generally.
Ariel.
For the manufacturers and the developers in the audience, be transparent about what you're doing well.
Tal.
Disconnect the internet. You'll be the most secure network on the planet.
Tal didn't hear me say actionable, but we're going to keep going.
Actionable, break it to small pieces and secure each piece separately, and then combine it
Great.
together into a continuous
I have
network.
0 now, so I'm going to be very quick. As you look for the things you're consigning, make sure you ask, is it secure by design?
Great. Thank you, everybody, for joining us here on
you.
this panel. This was
Thanks,
great.
Dave.